I'm Dr. Adam Golas, bariatric and general surgeon with Premier Weight Loss Solutions. When I did my residency training and was an intern on the bariatric service, taking care of those patients kind of early on, seeing the bariatric patients in regards to the benefits they would have with these operations in respect to resolution of their comorbidities, things like diabetes, high blood pressure, cholesterol issues, sleep apnea, being able to actually be cured and go into remission was very fascinating to me. My patients would be pretty much most everyday people, especially in Western culture. Obesity has really kind of plagued our nation. At this point, basically about 42% of Buckeyes suffer from obesity. So there's a lot of folks out there that could potentially be a patient of mine, specifically patients who suffer from obesity, but then also develop some of these secondary conditions, these what we call comorbidities. So like particularly diabetes is very prevalent among our patient population, high blood pressure, high cholesterol, obstructive sleep apnea, amongst other comorbidities that these patients can suffer from. So a lot of those patients who are suffering from obesity, but then also having these secondary health conditions are certainly patients who could potentially benefit from our services, both medical and surgical. My philosophy of care for my patients is really kind of patient first. And where that comes from is the fact that I understand, because I've been a patient before, and when patients come in, particularly to see a surgeon, it's anxiety provoking. And not every patient's coming in to the visit in the hopes of having an operation, nor does every patient coming in to visit actually need an operation. So my main focus, once I start to see that patient, is to really approach that care just as I would a family member or a close friend, in regards to just doing my best to educate them based on what I've learned about their history in regards to their disease process, and also both the risks and potential benefits of a surgery if it's indicated for that patient. So if a patient were to want to explore the possibility of something such as bariatric surgery, the services we provide, like a sleeve gastrectomy or a room-wide gastric bypass, we have them start with a free information session that we offer, multiple times throughout the month. During that session, we do a good job of educating the patient, focusing on educating them about obesity as a disease, the treatment options, both medical and surgical, and then kind of giving them a perspective of the approach and the expectations both before and after surgery.